Months after making a full recovery with an experimental drug, aid worker Pauline Cafferkey has been flown back to London in a serious condition, as symptoms of the Ebola virus re-emerged. Last week she was in London receiving a Pride of Britain award, but on Tuesday the 39-year-old was admitted to a hospital in Glasgow after feeling unwell. Public health directors made the decision that she should be transferred to London to the specialised unit at the Royal Free Hospital.
Once Pauline was admitted to the hospital in Glasgow, full precautions were taken and she was moved immediately to an isolation unit. So for staff, etc. at the hospital coming into contact with her, all precautions were taken in line with the national guidelines on this.
In a statement, the Royal Free Hospital said, Miss Cafferkey was transferred in the early hours this morning due to an unusual late complication of her previous infection by the Ebola virus. She will now be treated in isolation in the hospital's high-level isolation unit under nationally agreed guidelines. The virus is transmitted by direct contact with the blood or bodily fluids and can remain in the body months after the person appears to have fully recovered.
The virus does hide away, particularly we know that it hides away in the genital tract. So, for example, we can detect the virus in semen. It also hides away in the eyes and is often associated with visual complications. But at the moment, it's really unclear as to what status Pauline is in.
The Royal Free Hospital has said Miss Cafferkey is not believed to be contagious and her transfer to a specialised unit is part of a highly precautionary process.